Hi you guys, welcome back to my channel. So first off, I want to start and say thank you to everybody who's been so supportive, who's been so uplifting in my recovery as far as process and me just being transparent. And I appreciate you guys really from the bottom of my heart. Just want to let you guys know thank you. I appreciate you. I've tried responding to a lot of you guys' questions, but I feel like I'm just looking myself in the viewfinder because I'm not glammed and it's going to be the real raw uncut version. I am kneeling, so I'm going to try to make this as informative as possible, but also I can't be on my knees for a long period of time. I can, but for the most part this is the most comfy chair that I have. But of course, you guys know that I'm recovering from, my BBL surgery with Dr. Christine Dowback and out of Miami, Florida. And I just wanted to get to you guys. Questions, frequently asked questions. I responded back to you guys. Like I said, a lot of you guys had a lot of questions, so I just wanted to make one video answering all those questions to the best of my knowledge with the experience that I've had. And try to give you as much information as possible. I did write a list of questions that you guys have asked. So without further ado, let's just get started. So the first one I'm going to talk about the doctor that I had. So my surgery I had was a BBL, 360 lipo BBL. I had my full back, my stomach, my full stomach, and even underneath here. So my full stomach, my full back, underneath here, even up to like where my armpits is. I still have bruising here, slightly. I had all that fat transferred to my butt. So a lot of questions. I'm sorry, I might not be in frame a lot of these questions, but I'm gonna try my best to. Like I said, the chair that I'm sitting on, I'm not on it at full capacity. I can't sit my butt on it, so let's just get started. Let's just keep on going on. So my height, weight, and BMI. My height, I'm 5'5.5". My weight at the time I went in was 197, and my BMI was at 32. The highest that you can have surgery is at the BMI is 34. I know a lot of you guys had asked me that question as well, so I just want to just touch base with that. With Dr. Christine Dowback, I had surgery in Miami, Florida with Dr. Christine Dowback at New Life Plastic Surgery. Now, that's another question. I'm going off this. She is affiliated with New Life Plastic Surgery. However, she has her own facility outside of New Life, and that's where she works out of. She has her own office. Your contract, your office visits, your massages, even after if you get the package, is going to be in her office, which is off of West Flagler, I believe. If you watch the vlog, you will see it's the Christine Jurgensen Center, and it's Glam Life. Now, your contract, when you get it, it's going to be Glam Life. Your initial consult person that you get your quote and stuff for and you submit your pictures to for Dr. Dowback to look at, they are in New Life, the actual building, New Life building, which is in a different building separate from Dr. Christine Dowback. Your payment, everything that you do is going to be with Dr. Dowback's office. Your surgical coordinator, the one who overlooks your labs, your blood work, the anesthesiologist, all that stuff is in Dr. Dowback's office. The only thing that you go through New Life for is the initial person you're dealing with that you get your quote from, consultant, I guess you want to say, and you discuss your contract with and that kind of thing and alter your contract. That's who you would do that with. That's the only person. Even when you get to the facility, they're not there. They're in the New Life building, which is on a separate street. So just to claim that up, a lot of people are asking whether she works with, yeah, she's affiliated with New Life Plastic Surgery, but she does not work out of that building. She has her own building, her own facility, her own staff, her own front desk. and I can list all that information in the description box below. My before and after weight. Like I said, my before and after weight, before I was 197. Right now on the scale, I'm still 197. I think it has a lot to do with me swelling. My swelling has went down tremendously, but I feel like it's going to get lower. I do have kind of an appetite now, and I haven't been eating the healthiest, but they said feed the fat, but I'm not trying to do overboard, just because I don't want to gain the weight back. And you can gain the weight back in other areas. Like I didn't have my arms lipoed or my thighs or anything. In the first place, I usually gain weight is my thighs, and I don't want to be misproportioned. So I have been doing, you know, like I eat a lot of fruit. I try to do a lot of salads, but there are sometimes I have to have wings. Like remember before I was off meat, I'm back on meat. Which I'm probably going to give it up again, but that's neither here or there for right now. So I got my procedure. I also, by the way, I also did lipo on my chin. Now, I don't see much of a difference. I don't know if you guys can tell. I don't see much of a difference just yet, but I do know that it was done because I can definitely feel the tenderness of it there. So now I'm kneeling and standing. So I definitely want to put that out there. I am wearing a head wrap that I have. I just took it off for this video so I can slick back my hair. But you wear a head wrap like this, like a gauze, not gauze, what is this? Like a bandage wrap, ace bandage wrap type of thing. I wrap it around. I have to wear this for 6 weeks. So I am currently 3 weeks on Friday. Post-op, and yeah, that's pretty much it. I know that I see a slight difference, but not a major difference. So I'm going to continue wearing. I have to wear this continuous 6 weeks. I cannot sit for 6 weeks. I have been kneeling, even at work. I have been kneeling in my knees and sitting on possibly like my elbows, just like I'm doing now. And it's a little annoying, to be honest with you, but that's the name of the game. Let's see, facility, location, my price. Okay, so my price, I paid at the time, my quote was given to me August 2019, and I got the price right before the price was about to go up. My price was $5,500, and that included the cell saver. Now, the cell saver is basically where they take your own cells and they give them back to you, but in better condition, so that you can save and preserve your cells, your fat cells, for a healthy transfer, if that makes sense. Yeah, she's giving you back your own blood, your own cells, which she would do anyway, but she's preserving them or keeping them, a procedure she does to keep them, you know, so that you get the best possible results. Let's see. Altogether I paid $6,000 because I had I paid for a package, which in the end you have to weigh it out, your options, what's best for you. Now in the package it includes the surgery, the lipoform boards, which I didn't even get because I didn't go back up there to get them. And those lipoform boards are not at Christine Jurgensen Center. They are at New Life. So you would have to take another trip over there, which doesn't make sense. And I feel like it didn't benefit me. So with the package, you get the surgery, the lipoform boards, and you also get 3 massages. It also includes your faja and your compression stockings. Now, for me, I feel like in the end, I didn't benefit from the package. I actually lost money because, one, I didn't have massages at the facility. I had a massage therapist come to my recovery home. She was servicing some of the other girls, and out of convenience, I chose to use that option. I couldn't alter my contract once I was there, and I couldn't switch it out for anything because, in addition, I paid an extra $500 for my chin, if that makes sense. So altogether, I paid $6,000, $5,500 for the full package, which included the massages, the lipo boards, which I really didn't use. I didn't use and I didn't need. If you see the breakdown of my actual receipt in my vlog. You'll see what I paid for. And it just didn't benefit me, so I lost out on the massages because you have to go to the facility every single day at a specific time for your massages. So I missed out on that, and I didn't get the lipo foam boards. I had already purchased lipo foam boards ahead of time, so for me it didn't benefit for me. I could have really did without that. Also, another thing was, what was it? I was gonna say I paid additional $500 for that, so for my chin. So that was a total of $6,000. I don't know if I said that. I did say that, but just so you guys know, it was a total of $6,000. Let's see. Like I said, the contract. Once you get the contract, you cannot alter. You cannot substitute. You cannot wait. It cannot be substituted in any way, shape, or form. So say if you don't want the massages because now you're at a recovery house and they charge you back and forth for a fee for back and forth. If they have to transport you, if you're using them, or if you have to have Uber and you have to go back and forth, it doesn't benefit you. To me, it didn't benefit me in the long run. It was easier for me just to have someone come to me. And it just basically depends on you. So that's basically up to you whether you decide if you want to get the package or not. I highly recommend that you, before you even get into contract or you sign any papers, you have the understanding what you're getting for the full service of your quote. I do know now that the prices went up. A young lady told me yesterday that they quoted her. She wanted the lipo for the chin as well. So I think they went up $500. So right now I think the total work is $6,000. And if you want anything additional, it's like $500. So say if you want your arms, your thighs, it's additional $500 for any other additional area. How far in advance did I plan for the surgery? Again, I planned it back in August 2019. My original surgery date I think was supposed to be December, but I didn't want to do it around the holiday time because a lot of times doctors take vacation, and I wanted to make sure that my doctor was going to be on staff in case emergency purposes and I needed that. So I would plan around that. Ask as many questions as you possibly can. And yeah, that's pretty much it. My recovery house, I stayed at the Resort Recovery House. I stayed there. I'll put that information in the description box below. I stayed there from January 22nd. I got in that evening and I stayed there to the 28th. So, what is that? 4 days? 22nd, 23rd, 24th, 25th, 26th, 27th, 28th. Oh, it's taking like longer than that. 7 days. 6 days. 6 nights. So, and then even though I left there, I feel like I should have stayed even longer. That was personally me, just because of peace of mind. When you come back home, you don't have the help that you had there, which was so fine for me because I felt like I was doing well. But even still, you have somebody waiting on you hand and foot. All you have to do is press a buzzer, and I like the convenience of that. So I for sure stayed a few days, but not that. I feel like the faster you come home and get back into your routine, is better. So I would say 50-50 overall. Yeah, I stayed at a Resort Recovery House. They're about 25 minutes away from, Dr. Dowback's office. There was other girls who stayed there in the recovery house with me, and I did travel alone. I don't have a problem traveling alone. Now, if you feel more secure traveling with somebody or you having a surgery sister, that was fine. But you bond with other women there that are in your recovery house, and you keep in contact and you checked on one another. And it was overall an experience that was, I feel like, was inspiring, and it was liberating. And I don't have any regrets whatsoever. I would do it all over again, even with my sporadic pain here and now, which I'll go over in a second. I still would do it all over again. Let's see. The cost of my recovery house and my flight. You guys asked about as well. The recovery house, I believe, I put $200 down as a deposit. I think it's only required $150 for a deposit, and I stayed for how many days? I think altogether I would say I paid $1,000, an additional $1,000. That's not including my massages. My massages, I think I paid $300 for massages. I got massage every single day. And the masseuse that you do, she does have like specials, so you need to look into that. I booked with Ari. She transfers, she's mobile. You can look in my description box. I'll put her information. I also put it in the last video as well, but I will put it in this video again. My flight to Miami, I paid for that in advance, and I think that was a total of $160. I don't think I paid more than $170, to be honest with you, for a round trip from Atlanta to Miami. Let's see. Downtime, recovery time. Downtime, I would say I'm much better than I was even when I left there, and I feel like people need to take their own time. Be patient with themselves. Your body went through a big procedure. And even though I was mentally ready to get back on my feet and go back to work, which I tried to do a week early, after having major surgery, I couldn't. I had stood on my feet and I was swelling, and I felt like swelling in a sense that the more I stood, even though I wear my compression stockings, and when I was standing, I was swelling, and I can feel it, and I just wasn't ready to go back to work. So I would definitely I would not go back to work prior to 2 weeks. 2 weeks, definitely. You need to sleep, you need to rest, you need to eat healthy, you need to enjoy the time, because I'm the type of person that needs to get back. Like, I feel like I need to get back, I need to get back to work, I need to do this, da, 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 da. No. I need to sit my tail still, and I could not work, go back to work and, operate. So give yourself enough time, whether it's 2 weeks, 3 weeks. If you could take that much time off, I took 2 weeks off. That's what I need to do for me. And I wouldn't recommend anybody going back prior to 2 weeks. Let's see. I hope I answered that as far as downtime. Time off from work, I took 2 weeks. Recovery time, I'm still recovering. I mean, I have moments where they're better days than others. Overall, I feel like I'm doing well. My swelling has went down tremendously. I do have a massage therapist who comes to my home. And she is in Atlanta. I live in Atlanta, so she comes to my home twice a week, and she does my massages for me. If you guys want me to do a video on my post-op massages, I will definitely do them. In the beginning, the first one was brutal. When I mean brutal, brutal. Oh my God. After you have surgery, you do not want nobody to touch you. Like, and I'm just be honest with that. The pain level will go into that, because I feel like that's one of the questions as well. The pain level. You know that you're having surgery. It's going to be painful. I spoke to a girl last night. She said she just had surgery and she didn't have no pain whatsoever, because she took her pain pills right after. She didn't have any pain. You do get your medicine the day before, so I would suggest you filling your medication the day before, so that way when you come back home, you can take them right away. I didn't do that. After I got home and I had surgery, I went for them. I had Alex at the recovery house go get my medication, but she said she didn't have any surgery. The lady asked me to last night. Sweet girl, and I wish her all the best, as I do all of you guys. Let me see if I can stand up. Hold on, because I cannot like sit. Like, when you sit on your knees too long, it's painful, and like you start getting numb. I sleep on my stomach anyway, so I don't have a problem with sleeping. But yeah, what was I talking about? As far as massage, I have someone come there twice a week. I feel like some days my pain level, okay, the best word is the pain level. My pain level, I have a high tolerance for pain. I can take pretty much anything, but it's more of an annoying sensation now. My symptoms that I have now, I have occasional swelling in certain areas. My stomach is still kind of tight in certain areas and sensitive in most areas. Mostly my flanks on the sides here are painful. Especially when I get my massages. Massages in the beginning were brutal, like brutal. Because you don't want anybody to touch you. As soon as you have the surgery, the first day you feel like, for me, you feel like you got hit by a bus. Period. Like, I don't care what anybody says. You feel like you got hit by a bus. I never had that experience, thank the Lord. But if that was the case, that's what you would feel like. you feel like you're completely sore. As you saw in the vlog, you are bloody. I felt heavy in a sense. I was getting overheated. Overheated means I'm hot natured. So and I still like Converse. Like I feel like my body heats up, and it feels like a sunburn. And that's the best way I can explain to you. Sometimes I feel like I have a sunburn all over my body that you can't see, and then you gotta kind of calm down. I was putting ice packs or like a Ziploc bag and put a whole bunch of ice in it. I had 2 of those and I would put them on my back to keep me kind of cool. Even when I slept with covers or didn't sleep with covers and I was underneath the fan, I would get hot sometimes. Sometimes I'm cold, and sometimes I have swelling. I have pain. I looked up the symptoms. They said it's completely normal. I think that's why they suggest that you do not expose yourself to the sun for 6 months, because you've already had sunburn. So, not sunburn in a sense, but you already been like burnt in those areas. That's what they're doing with the candela underneath it. There's a stick that goes in there. They're like burning the fat. So if you expose the sun, you're going to burn up. I've used arnica gel. I do not like arnica gel. For me, it just did not. It's like an icy hot sensation. I hate icy hot. So that was not something I wanted to resort to. But they do have other pain relieving creams that you could use. Let's see. What else have I used? I was taking the medication in the beginning, the Percocet. But then it was just too heavy and groggy, and then you have to get up every 2 hours to walk. So it's heavy for you. You're using your upper body, which is you're limited because you don't have any upper body strength, because you're sore from underneath your armpits all the way down. And taking heavy medication like Percocet makes it groggy. So I started using Percocet and Tylenol intermittently in between, and that kind of helped me until I got off the Percocet and just was taking Tylenol. So occasionally I will have Tylenol. I'll take some Tylenol even now. I don't have so much swelling right now, but I do get the hot sensation, sporadic pain, like almost like nerve pain, which is nerve pain, and that's really it, which is all normal. Even with that, again, I want to say that I would still do it again, 100%. Let's see. When can I sit on my BBL? Okay, so I can't sit until after 6 weeks. Then I can sit, and yeah, that's pretty much it. How much spending money should you bring? I would say bring an additional, if you paid for your recovery house in the beginning, I would say get all your recovery house fees out. Consider your money for your massages. You don't have to worry about food because your recovery house covers that. If you have to pay for additional expenses like transportation or supplies, consider that as well. Understand that the post-op massages could be anywhere from $80 to $100 per massage. So take that in consideration. I don't know who you guys are going to use, but if you're going to get a massage every day, which I highly suggest, especially in the beginning, even though it's brutal, even with the pain meds, for me, I was like, no. I feel like with me having everything paid, I feel like I still spent another $500 outside of me paying everything. So I would just bring an extra $700, honestly, to be honest with you guys. Let's see. That's another thing. Besides having the money there to have an extra $700, when you come home, you have to understand that you have to have post-op massages at least once a week. And even when you come home, you have to find somebody. Some people offer massages. I don't know where you guys live. You know, you guys are from everywhere. So wherever you're going to have your post-op massage, it can be anywhere from $80 to $100. So right now, I'm paying basically like $200 a week just to have massages. 2, 4, 6, 8. I'm spending $800 just on massages. That's not including any additional bills that I have to pay. So don't just think about the money you have to spend there and bring with you an additional money. Think about the money you have to spend when you come home as well. Like, that is a major key. Your post-op care is more important than the actual surgery, because you're shaping, molding your body. So basically it's up to you. Let's see. I already answered that. How much money should I bring? What's my BMI? Doctor's BMI requirement. I already experienced that. The BMI requirement. My BMI was 32. BMI requirement for Dr. Dowback, Christine Dowback, is 34. Symptoms to be aware of, side effects. Symptoms to be aware of. I think I already went over that. The tenderness, pain that you have, swelling, I would say, the overheating, you feeling like you have a sunburn. You're still, my laterals, my side, are still sore on the bottom portion. In the beginning, I had no appetite after surgery. I felt like I actually had a baby. In a sense, if you have kids, you guys know you don't have an appetite. Your stomach feels like smush. Especially since I didn't have a tummy tuck, it feels like that. But I will insert pictures of what my stomach looks like. I took them yesterday. And I think it looks pretty good, to be honest with you. I still do have a lot of swelling. I have my masseuse come, and I keep on asking her if, you know, she's like, no, you're not gonna have any seconds, because it's all inflammation on the sides, you'll see. But my stomach has went down tremendously. Oh, like my senses is also, like, I feel like my senses are more where, you know how like when you are first pregnant, your sense is like key on point. Like, that's exactly how I felt. So I had a lot of those symptoms. No appetite, itchy, your body itches. Oh my gosh, that is another thing. You have itching like no other. Your full body itches because your body has expanded, contract, you know, in certain areas, so you're itchy a lot. Even on my chin, I've been itchy a lot. Burning sensation, overheating, etc. No appetite, I got the senses. How do I use the bathroom? Okay, so when I use the bathroom, even when I was there, let me show you. I bought this off of Amazon. So basically you can see this is my, what is it? This is my board, okay? It's like I bought it from Amazon, and I'll put a link down at the bottom. I don't have affiliate code, nothing like that. It's just for you guys' purposes. I paid $25 for it. I had left 2 of my BBL boards here in Atlanta, and I had this Amazon Prime to me before I left. Now this is how I use it. I put a plastic sheet. This is an ASOS sheet. The flat part I put on the toilet, and literally I sit my butt, I sit my thighs on that, and I go to the bathroom. My butt is not touching. And let me tell you, after I use the restroom, okay, we're just talking about number 2. I know it's TMI, but you guys, I'm just gonna tell you. After you use the restroom, you want to pull. You're gonna bend over, your butt still, after you took a dump, okay? You're still gonna be bent over, all right? You get your legs, your thighs up, you stand up, right? And you pull that BBL pillow from underneath you, okay? Throw it, and then you get some wet ones. Let me tell you something, these have been a lifesaver, okay? You get the wet ones, and you're still bent over, okay? Bent over. And you go from the back. I mean, you go underneath, okay? You go underneath, and you clean yourself, okay? They're white, they're super wet, they're thin, they get to the target area, and you're able to clean. Now, at this point in time, your butt cheeks are still kind of firm, kind of tight, okay? You can still use a cold lace to have a soft stool. Even if you have a regular solid stool, I'm just being honest with you guys, we're all human, okay? We excrete waste. You're going to clean, and you're going to clean, you can still be bent over, and you're going to clean your whole butt, okay? From the crack, okay? From the crack of your butt all the way down. And you're going to keep on to it till it's spotless, right? And that is the easiest way to clean, okay? I'm just going to be completely honest with you. Have I bought any boards? I've bought boards from Amazon. Like I said, because even though the boards I paid for, I didn't get them. But I can honestly tell you I haven't used my board that much. I probably used it three or four times. This is by M&D. This is a brand that's big in Colombia. I have a faja that's M&D. Oh, that's what I want to talk about. But I bought for $100. It's a standard faja, which I don't recommend, okay? If you're going to get your stage 2 faja, please, ladies, get measured for it, because everybody's body and shape is different, and you want to make sure that your faja fits you and can decrease in size so that you are not paying for many fajas, okay? I bought these also LIPO forms. These are the ones I told you, I showed you I bought, and I put these underneath my faja sometimes on the sides or here, so it gives me comfort. The only reason why these are beneficial, you can use those or use pads. The only reason I say it because when you put on your faja, your skin is very sensitive and you don't want nothing touching your skin. So you put those on so that you do not have faja burns. Your skin is very delicate. I have 2 faja burns, which I did to myself, because I coated certain areas, but I missed a spot and I didn't have a faja, and I basically burned myself. Not in the sense of burning, but it's a faja burn because you didn't have nothing on your skin sensitive, so it left a mark. But it will clear up. I'm not worried about that. It's healing. You'll probably see in my my picture that I will post and insert. Let's see. Do I use bathroom, post-op care? How many massages do you need? They recommend 20 to 30 massages after surgery. I get mine twice a week, a minimum once a week. They can range from, like I said, $80 to $100. I pay basically $200 a week to have my masseuse come to my home. And sometimes you have to take into consideration that they do charge extra fee if they are coming to you. So, my massage therapist in Miami was Ari. I will put her recommendations down there. She's amazing. I highly recommend her. I go off her energy too. Her energy is amazing. She knows exactly what she's doing. She has years in business, and she also does the taping method. Now, a lot of you guys, I know one of you guys said the taping method. She had taped me the last 2 days. Taping method basically is where they tape you to hold or mold, would you say, hold and mold your shape until your inflammation goes down. And usually they do not do massages over it. They can massage it just like following the tape 10, 11 times, but each tape, but it's basically to mold you and help shape you and keep you from having, if you have hanging skin, a tummy tuck coming back in, because it holds the skin up and holds your shape into place as they're molding it for a few days. Usually you can keep the tape on from anywhere from 3 to 10 days, depending. You can still shower with it. It's water resistant. They use it a lot of times for athletes. So I know there's not a lot of information on that, but Ari, the one who did mine, did the taping method the last 2 days, and I kept it on. I would say after I left her, I kept it on 3 days until I got my next massage. Let's see. Okay, a lot of you guys, one of you guys had asked how's my stomach come along since my tummy tuck. I mean, a tummy tuck. Lord, I'm not having a tummy tuck. That's the main reason why I picked Dr. Christine Dowback, by the way. When she saw me, she's like, I'm glad that you didn't have a tummy tuck. She's like, a lot of patients have tummy tuck, and they go to doctors who suggest a tummy tuck because they don't know how to do surgery without performing a tummy tuck. The main reason why I picked her, I saw a lot of girls who were bigger in size than me who she performed surgery on, and she didn't give them a tummy tuck, and they still had a shape. And I highly recommend her. That makes her stand out to me even more, because I didn't want a tummy tuck. I have my stage 2 faja right here. I got it from So Snatched. the massage therapist who I was going to, she orders them for you. She measured me, and let me tell you something. This is not for the faint of heart. This bad boy is a beast, okay? It helps mold and shapes you, but this thing is no joke. So I highly recommend that. I did wear it, probably would say, for a week, and then I could not, like, I can't sleep with it, and I didn't want to it pass over my butt so much. It was so tight, so I haven't been wearing it. I'm wearing my regular faja that I got from my from the surgeon, from Dr. Dowback. Also, another little tool I want to tell you guys about, I bought from Amazon. I highly recommend it. This is what is called Energy Beauty Bar. I bought it from Amazon. I saw the reviews on it. It was almost like 5 stars. Basically what it is a gold massage stick, and it looks like this. And I use this. It contracts also. So I use it to, it contracts and pulls in the skin also along. So when I do take off my thing, I do this for like a good 15-20 minutes, set my timer. While after I take a shower, they tell you, my massage therapist told me to wait 15 to 20 minutes before putting my faja on. Dry your skin, lay down on your stomach, and I do this little beauty treatment before I put my faja on. Give your body time to contract, rest, so it's not so much pressure. But this beauty bar comes with this one, and it also comes with another one, a flat edge one. It does the same exact thing. They do have you have to put AA batteries, but like, same thing. I don't know if it really works. I mean, it feels amazing, but I'm gonna try it. I'm gonna incorporate it in my skincare, you know, for that smooth chin line. I mean, I do know that they did work on here because I can feel the tenderness. I just don't see a major difference. Unless you guys see something, let me know. Let me know in the comments. I hope I touch bases on everything, you guys, that you guys wanted to know. If y'all had any questions about, if y'all have any questions, feel free to ask in the comment section below. I'll be more than welcome to address them for you. Yeah, hold on one second. A lot of times you can only be in these positions for so long because my body parts get numb. So I know you guys can barely see, but as you can see, it has done a major, let's go. Okay guys, so this is my stomach, okay? So what it looks like right now. I still have a lot of swelling because this is all swollen. This is sensitive here. This has swelling here. It doesn't look the best, but I'm not worried about it because all of this is swelling right here. It's all hard. Even here on the sides. I asked him if it was going to go, my massage therapist, I asked if it was going to go away. And it is. So I'm not concerned. You see, oh sorry. I have this swelling on here, but there's no shame in my game, you guys. I could care less. I'm having more results. Even here, this is hard right here. So as far as me not having a tummy tuck, I'm okay with not having a tummy tuck as long as the swelling goes down. And I haven't been waist training, so I feel like all this is gonna go once I have the waist training. I'm getting ready to my stomach's gonna be nice, you guys. I'm gonna put some vitamin E on here. But to be honest with you guys, this is what it looks like. I don't have any regrets, even after. I don't have no regrets. This is what my stomach looks like. I don't care. This is the stage. This is what I'm going through. This is where I'm at. This is my 3-week mark. And it is what it is. I know I'm going to be summertime fine. Wait till summer comes around. I'm going to mold and shape this body to filth. So I know what I want to look like. I know with ideally, I know I'm out of range. And am I open to having more surgery? Absolutely. I do want to get my breasts done, and I'm thinking about getting my teeth done. Don't know. I think I have pretty teeth. I'm just gonna whiten them because I have hard, I have good teeth, but I don't know. We're on the road to perfection. 2020, it's all about self-improvement, doing what you want to do, making yourself feel the best that you feel possible, whatever that is. Whether it's surgery, whether it's not. I'm not here to promote surgery. I'm just telling you and expanding, being transparent with you guys as to what I plan on doing, if I plan on doing that. And I'm open to whatever makes you feeling your better self, your higher self. We're in high vibrations this year. And it's all about what you're trying to do for yourself. Bettering yourself, putting yourself, whether it's buying a home, whether it's buying a car, whether it's treating yourself, massages, out to dinner, like which I do anyway for myself. It's all about self-love and self-care this year. Being on your grind and doing the best that you could possibly do for yourself. Putting yourself in a better position. And I hope I will inspire you guys to do and go after what it is that you want to do in your life. And this is my journey. And I thank you so much for allowing me to share with you guys. No judgment, no nothing. And just being free. Thank you guys so much for tuning in. If you have any questions, I'll put as much as possible in the description box below. And if you have any additional questions that I didn't touch base on, please leave them. I'll respond back to you and tell me that. And just give me some time, because sometimes the notifications don't get to me. But if my phone is in my hand, I can see them automatically and they'll get to me. Some of them I do miss, and I have to, you guys get hit like maybe 48 hours, 3 days later. I apologize about that. But whatever questions you have, nothing is a stupid question. So ask away. And I love you guys. Thank you so much for tuning in. And let me know what you guys want to see next. Bye.